The gift ship in Imo, it's running exceptionally well.
Okay, Mr. Chimese, thank you so much for that brief explanation. I know we have more time to go into details, but at this early stage, we just wanted you to just clarify for our people what NHIS is. So it's a federal government health insurance program. That's what I take from what you have said. It's a federal government health insurance program. It is managed by the National Health Insurance Authority, which is a federal authority, federal office, and it is for all Nigerians, whether small, young, old, stuff like that. And it has been around for the past how many years now? Did you say 10 years or something? How many years now?
Myself, 24 years.
No. I mean that the gift ship, the health insurance, has been around.
Yeah, gift ship has been around for the past 10 years, exactly.
Okay, for the past 10 years. And people have been using it and everything. Okay, so so those are basic facts that we need to establish. Dr. Uche, we also have this Imo State Health Insurance, which is different from the National Health Insurance. Can you tell us a little bit about the Imo State Health Insurance and how it is different from the National Health Insurance? Thank you.
Okay, thank you very much for that. And thank you very much, my state coordinator, Mr. Chimese. Imo State Health Insurance Agency is a product of the Acts of the Imo State House of Assembly that ensures that people who are residents in Imo have access to quality health services via an insurance program. I could recall when Father visited us at the agency when I just resumed, and we were all at the planning stage. I'm happy to announce to you that not just that we have concluded the 4 major programs we're implementing at the agency, we have commenced all of them. So we have 4 major programs we run at the Imo State Health Insurance Agency. Because by virtue of the Act of the National Health Insurance Authority 2022, it's either you join the health insurance program, which is now mandatory, via the State Health Insurance Agency, or through the National Health Insurance Authority. So either which way, what is most important, you have financial risk protection. So we have 4 major programs we are currently implementing here. The BSCPF, which is a product of Section 11 of the 2014 National Health Act. In that program alone, we have 85,000 Imo citizens who are currently accessing care in the 305 INEC wards in Imo State. And so far, based on the last data we have, the Imo State Health Insurance Agency has managed 213,000 cases. 213,000 cases on the BSCPF program alone on 11 months. And out of this, we have had over 639 secondary cases. And these secondary cases are mainly referrals, mostly cesarean sections. And over 1,200 babies have been delivered through the Basic Healthcare Provision Fund, which we commenced access to care on the 1st of April 2023. Not quite long after Father visited us at the agency. We also have the formal sector program, which is the program for people in formalized employment. That one is being paid for by His Excellency Distinguished Senator Opuzodema. There are about 37,233 civil servants, and they commenced access to care in the 27 local government areas in Imo State since November 1, 2023. We have the TSHIP, which is the Tertiary Institution Social Health Insurance Program. We have just developed the rebranded TSHIP guideline that enables students in tertiary institutions to access quality health services with its referral networks in all tertiary institutions in the state owned by the state government. It is just awaiting executive approval by the distinguished Senator Hope, who's by the governor of Imo, which I have left for us to discuss here, which I presume will be the one that will be of most interest to people within your network, diasporans, family members, individuals, groups here in Imo State. It's called the Imo Care Health Insurance Program. The Imo Care Health Insurance Program is a locally designed health insurance program that enables groups, individuals,
network issues,
diasporans, constituents, insurance without suffering financial hardship. So the Imo Care Health Insurance Program is similar to the gift ship that you have at the national level. In the course of these conversations, I will tell you the pricing based on the costing and the standard benefit package we are currently using for the Imo Care Health Insurance.
Okay.
The beautiful thing about the Imo Care Health Insurance Program is that Imo Care Health Insurance is implemented in the 27 local governments in Imo State. So we have accredited facilities in the hinterlands. The same facilities we have used for the Basic Healthcare Provision Fund, and some we're using for the TSHIP program, and the one we are currently using for the Imo State civil servants. Mind you, the civil servants are both local government civil servants and the state civil servants, including MDS. So the same facilities we are using for them, which will commence on the 1st of November for the civil servants, is the same we are using for the Imo Care.
Okay,
So
okay, Dr. Olike,
let me run on.
Okay.
The beautiful thing about the Imo Care Health Insurance Program is that it can be implemented in the 27 local government area in Imo State. Thank you. Over.
Okay, thank you, Dr. Olike. And just stand by there because I have questions for you so that we can break this down for our viewers. Imo State Health Insurance Agency is implementing health insurance in Imo State. I want to know about, the different kinds of beneficiaries and how it is working. First and foremost, who is funding the Imo State Health Insurance Program? Who is the funder?
Generally, all over the world, insurance works on collective pool, and the funding comes from this collective pool. So there is no specific funder for the health insurance pool. However, the state government pays for the civil servants. The tertiary institution social insurance program, the students contribute for the TSHIP.
Okay, so apart from the civil servants and apart from the civil servants, who else does the government pay for?
The federal government and the state government through its counterpart paid for the vulnerable population, which is called the Basic Healthcare Provision Fund. And this fund is a product of the act of the state of the National Assembly, so its financing is sustainable. The funding that comes from the state government is for civil servants, which is also made it sustainable. Then the rest funding comes from the Imo Care Health Insurance Program, which people, constituents join in. Currently, 2 members of the National Assembly and the Senate have developed interest to cover.
Okay, Dr. Uche, very well. So the Imo State Health Insurance, the state government pays for civil servants, and then the federal government and the state government pay for vulnerable people. Who are these vulnerable people? Can you define them for us, and where can we find them?
Vulnerability for the Basic Healthcare Provision Fund is in morbidity and socioeconomic status. So we have what we call socioeconomic status index assessment. We visit these communities, we use the officers in charge, and the WDC chairman. They are found in the 305 INEC wards in Imo State, ranging from Ehitoboma to Ngokbala, to Okigwe, to Onimo, to Oru East, Oru West. to Wangele, to Owerri West, to Ikeduru, every part of Imo State. They're out there.
Okay.
And vulnerability in terms of mobility, we enroll people more, pregnant women, children under 5, elderly people, and the very poor. It is the very poor that we use socioeconomic status assessment to assess. That's why when you see the videos of our utilization, you'll be able to see that these people are actually poor and that are the people that deserve the enrollment for that category.
Okay, Dr. Ewelike, thank you so much. So the vulnerable people, number one, so if any woman that is pregnant, the woman is entitled to free health care insurance under the Imo State Health Insurance Program. If anybody is elderly, I don't know what elderly means by age. What age is that? And the person will be then entitled to Imo State Health Insurance. I don't know what the age is. So at least we can be sure that pregnancy, we can see that. So when you're pregnant, then that this is an entitlement that Imo State government is giving you free health insurance to enable you then go to access care. The elderly people, of what age are we looking at here? Or you just have to look at the person and say, oh, this is an old person, and then he's free to access the insurance?
No. For every time there is a disbursement from the national, which is matched by the counterpart from the state, a certain percentage of the population is covered, usually in empirical numbers. So currently, Imo State has a quota of 85,000 people. And these 85,000 people are enrolled in the 305 INEC wards, clustered in different health facilities at the PSCs. But in the event that they require secondary referrals, we have a nexus of 4 IMSHA zones, Olu 1, Olu 2, Owerri and Okigwe, where we refer cases for secondary services in the event that there is a need. Now, how we identify this population? We consider first, prioritization goes to pregnant women. Next is children under 5. Next is the elderly people. Elderly is defined for the BSCPF 70 years and above. Okay,
Dr. Ewelike, you're muted. Maybe you mistakenly muted yourself. Now, Dr. Ewelike, thank you so much for this. But you have already enrolled these 85,000 people, and I'm sure we have more than 85,000 vulnerable people in Imo State. So what happens to the rest?
In health insurance, for everything that is consumed is paid for. So we pay for the number that is allocated for us, and that's the number we have to run with.
Okay, thank you so much. So our viewers all over the world, and then I have one more question. People that are enjoying this Imo State health insurance, which hospitals can they go to? Is it the primary healthcare centers in the village or any hospital at all in Imo State?
The secondary facilities are accredited. The primary facilities are also accredited. So in the 27 local governments, we have healthcare facilities, secondary facilities. It is only the BSCPF that is run at the PSC. It is not cross-run all at the PSC. Only primary services are rendered at the PSCs. The rest services are rendered at the secondary facilities. The secondary facilities ranges from facilities in Olu 2.
Oh, we lost Dr. Ewelike. I'm sure she's having problems. So I was going to come to you, Mr. Chimezie, after Dr. Ewelike, so that you can also explain things to us. But now that we lost him, maybe we can jump into your area. So, Mr. Chimezie, can you tell us who and who can access the gift ship health insurance? Oh, sorry, okay. I think Dr. Uchenna is back. Dr. Uchenna, you want to finish up? Mr. Chimezie, hang on 1 second. Let Dr. Uchenna finish up. Dr. Uchenna, finish up.
So sorry, it was network glitch.
Yes, I know.
What I'm saying is that we have facilities cut across. These facilities have been rendering services. 350 cesarean sections done in the last 1 year.
Okay, thank you so much, Dr. Uchenna Uwelike. So hang on there, we'll come back to you, but let's go to Mr. Chimezie. Mr. Chimezie, who can access the National Health Insurance program, the gift sheet? Can you break it down for us? Who can access it and how does it work?
Thank you very much, Father. The gift sheet, just like I said earlier, is for every other person that is not in the formal sector area. It ranges from people that are self-employed to those people that do not have more up to 5 employees. It can also be for people that are retired. And the beauty of a gift sheet is that it creates this flexibility for adoption. So people in the diaspora can equally pay for some of their relatives here. And the gift sheet gives everybody access to the entire health arsenal that is in Nigeria. Because from IMO, you can easily be referred to National Hospital in Abuja, and gift makes it in such a way that even if the health resource is not available in Imo State, it is still accessible to whoever is subscribing to the program. And there are other programs that we have designed. Just like I was talking about some challenges that we have experienced in the course of discharging our duties in health insurance. Like we have a program that addresses out of stock, and out of stock, that's for drugs. That is called a program that is called the NHIA Medicine Supply Initiative. With that program, very soon, these drugs will be available in all the accredited healthcare facilities, including those in Imo State, and will be available to people that are subscribing to the gift sheet. Gift sheet is the program that we designed for every other person that is not in the employ of the federal government or in the state government. And the way it is designed is in such a way that with the payment of just a paltry amount of money, the person is subscribed for a whole year. And the person also enjoys the whole health benefit that is available for the people in the formal sector. All the benefits that is available to the people in the formal sector is enjoyable under the gift sheet.
Okay, so Mr. Chimezie, you're saying that anybody in Nigeria that is not working for the federal government or for the state government, for you, those are the formal sectors you're talking about. Anybody not working for these two employers can access the gift insurance, health insurance, right? Yes. Is that what you're saying?
Yes, sir. I would also want to, just like Chief Uche said, this program was designed because health insurance is now mandatory in Nigeria. The act that established National Health Insurance Authority made it mandatory that every Nigerian and every legal resident in Nigeria must subscribe to a form of health insurance or another. So gift sheet makes it in such a way that anybody can subscribe from anywhere, and then access healthcare as far as the person is in Nigeria.
Okay, so it's a mandatory thing right now.
Yes.
What if somebody does not have money? What if somebody is poor to subscribe to the thing? Is there anything in the government in gift sheet for poor and vulnerable people?
So just if you are listening to Chief Uche, you would have heard of Basic Healthcare Provision Fund. Eventually, they are going to develop more programs that are not, that are for non-paying people. But for now, the much that is allotted to Imo State, just like he said, is in that neighborhood of 85,000.
Okay, so
now,
this
for those people that do not have money, sir, for those people that do not have
85,000 you're talking about that the federal government has allocated is not being managed by Imo State Health Insurance. So nobody can access it through through gift ship, right? NHIS, right?
No, it is managed by IMSHA, that's Imo State Social Health Insurance Agency. Now, okay. There is an adoption concept that is in gift ship that allows people to sponsor people that they can help, that may not have the wherewithal to pay for gift ship. But we have also gone ahead and also made it very, very flexible for people to subscribe to gift ship. In fact, at the payment of 15,000 per person, it can cover a person for a whole year, because gift ship subscription is on individual basis.
Okay, I do understand. We do understand. I just wanted to be sure what is available for the vulnerable people.
And we can also join some political leaders. Sorry, sir. Sorry, Father.
We're going to get to those places. We're going to get to the advertisement, but we just wanted to, first of all, understand all the intricacies in the whole thing before we then start calling people to support people. Because insurance is a very good thing, and I know that people can buy insurance for other people. We'll get to that point. But I wanted to say, you said it's mandatory for every Nigerian. Once something is mandatory, there must be a consequence for not obeying it, for not following it. So if a Nigerian does not have health insurance, what is the punishment? Because he says it's mandatory. So
yes, sir. We're still working on establishing that aspect of the law. But eventually, personally, I'm looking at lots of possibilities, like people going for some of the government projects may not have access to it if they do not have health insurance. That's when they start enforcing the mandatoriness or the compulsoriness of the law. Some people may have some challenge getting something like maybe their traveling documents or trying out any transaction with the government when this act is being made, is being enforced. But for now, we are still working on its enforcement route.
Okay, thank you. Thank you. You mentioned also that if a company has more than 5 people, the company is required by law to enroll all those people. If the company does not do it, what is the punishment? Can there be legal action against the company? Can they be sued? How is the government enforcing it? It's a law that the government made that once you have 5 people and above, you must provide health insurance for them. But I mean, there are hundreds of companies in Imo State, hotels all over. Their employees do not have insurance. So what are you guys doing out there about it? Why can't we take advantage of the law and then prosecute them?
Yeah. When the policy is in place, we intend to write all the organizations. In fact, we have made some incursions in the State Ministry of Trade and that area and Commerce to get the list of all the organizations that are registered with them. And we intend to, immediately the policy document comes in from the head office, we intend to distribute letters to all of them. And then we are also looking at the aspect of working with maybe Corporate Affairs Commission to ensure that for subsequent registrations or renewal of some of their documents, they must have some form of health insurance for their employees. So these are some of the things that measures and policies that will be deployed.
Okay, thank you so much. Thank you. Now, so let's go to benefits now. Let's go to benefits now. So we take home from you that the health insurance scheme is for everybody that is not working for the federal government or state government. And then it is required, it's mandatory, the government wants you to do it. And if there are vulnerable people, the federal government has given that over, is being managed by the state government through IMSHA, so they can go to get insurance for vulnerable can get there. And then employers who have more than 5 people are required by law, and very soon government can start cracking down on them. So if people buy your health insurance, where can they get service? In Imo State, for example, is health insurance accepted in all the hospitals in Imo State? Is health insurance accepted by pharmacies? What about medical laboratory centers? Can you use health insurance in those places? So how does a person know where to go when the person has health insurance? If I have it and I'm from my village, I'm Imo, and I'm sick, would that health insurance be accepted by the primary health care center in Amimo? Will it be accepted by, if I come to a private hospital clinic in Owerri? So if I have my health insurance, where can I access health? Some people also complain about medicine. If I go to DrugWise in Owerri or pharmacy, and can I use my health insurance there? If I go to Everite for medical test, can I use my health insurance there? Can you please, step by step, clarify this to our viewers?
Okay, thank you very much, Father. So first of all, when somebody subscribes for any of these programs, we have accredited healthcare facilities from FMC, that's the Federal Medical Center, to some primary health centers that are located in the rural and the sub-rural areas. Normally, we counsel people, choose a healthcare facility that is very close to where you are residing, so that should you have any form of emergency, you wouldn't start needing taxis or transport. You wouldn't be having transport issues. So people are expected to choose a primary health care center or a primary facility, or we call it primary provider. This is the gatekeeper. Now, there are 5 possible outfits that constitute primary provision under the NHIA. The first one is like a clinic that is just owned by a first-degree GP, not a first-degree doctor, a clinic owned by a first-degree doctor. The second one is the comprehensive health centers that are located in the sub-rural areas. And then we also have nursing and midwifery homes that must be overseen by doctors. Some of them are also floated out in the sub-rural areas. Then we have primary health centers. These ones are scattered all over. I don't think there is any community that doesn't have a primary health center. Then we have the outpatient departments of the secondary and tertiary healthcare facilities that are in all over Nigeria. So it now makes it in such a way, the choice of any of these ones constitute the primary provision outlet. So it is expected that anybody that is subscribing for any of these programs will choose a primary provider. These ones are paid by what we call capitation. So they are paid whether you go there or not. Now, the choice of the primary healthcare provisional fit, that's exactly where we expect you to go should you have any health condition. Now, when it goes beyond, each of these accredited outfits understand how the program runs. When it goes beyond that level of care, then referral to many of these places that you've mentioned, to some of the laboratories for accurate diagnosis, to some of the pharmacies, that's community pharmacies. So it is expected that when somebody has chosen a primary healthcare facility, that's the first point of call, then the primary healthcare facility will assess the patient and then determine when it is beyond the primary level of care. So when it goes beyond the primary level of care, it is now the onus is on the primary healthcare facility to refer to the secondary level of care. I hope I don't know whether it's answering your question correctly.
You have made some points. So, like for example, sometimes also we go to where you go to a hospital, they say they don't have a particular medication that you should go and buy it from pharmacy. If you go to the pharmacy, would the insurance cover it there?
Okay. Now, we have some accredited pharmacies. It is not every pharmacy that is in the program, but most hospitals are expected to make adequate provision for the medication. And should they request that you go outside to purchase them or to fill out your prescription, it is expected that it's a bridge. And we expect the person to come in and lodge a complaint against that particular healthcare facility. But NHIA, in our own wisdom, we have also gone further. We have an initiative, a new concept that we want to use to stamp out of stock from the hospital. It is called NHIA Medicine Supply Initiative. And we have signed some major deals with big pharmaceutical companies like Pfizer and Roche to provide some of our drugs. And we intend to use these in all our accredited healthcare facilities. These drugs, they will make a major inscription on it that these drugs are not to be sold. Okay. They can only be dispensed through to National Health Insurance Authority patients. So these are some of the
Thank you so much. Thank you so much. Yeah, I do appreciate all the responses you have given. Yes, sir? Thank you so much. I do appreciate some of the responses you have given so far. And but we now have to go into the coverage. Dr. Uchenna is not here, but I hope he comes in. So what and what are covered in this package?
Father,
wait a minute. Before I go to you, what and what are covered? Can you mention, the common illnesses that our people are familiar with that may be covered? And I'm sure people will ask questions around it, but I know you may not have all of them off the top of your head. You can also refer all to it.
So I think the right question should be what and what are not covered, because virtually everything, health insurance, like the benefit package of our health insurance in Nigeria is very comprehensive.
Okay, so what and what are not covered? What and what are not covered?
Thank you. Okay. The things that are not covered are things that either they have another organization that is taking care of them, or they are covered. There's an organization that is scheduled with that. Let me give you a very good example. Look at the things that are not covered. Epidemics are not covered. This is because there is NEMA and NCDC that are scheduled with those responsibilities. So please, I hope you're listening. I'm no longer seeing the father.
I'm listening. I'm here.
Okay, so epidemics are not covered. And then there are some very high level technical sports that are not covered, like skydiving. Some of those very risky sports that people get engaged in. That's, should they sustain injuries from those sports? They are not covered. Then there are some high-tech procedures, like when you come over to intracytoplasmic sperm injection and IVF, those are not covered. And then you come over to ophthalmology. Some of these, what do they call these implants? Lens implants are not covered, but low-level spectacles and management of all ophthalmological cases are covered. You come over to surgery. The part of surgery that is not covered are all these plastic surgeries. Those butt augmentation, breast augmentation, and some of those ones that are not covered. Then we come over to pediatrics. Some congenital conditions that require very invasive procedures are not covered, like pathology of phallus, some of those ventricular septal disorders and stuff. Those are not covered. Then in internal medicine, the aspects that are not covered are being overseen by other organizations. There are programs that are covering those. Something like tuberculosis, because there is a robust tuberculosis program and leprosy program that is also overseen by the Federal Ministry of Health. So these are some of the things that are not covered, but even some major reconstructive surgeries are all covered in our program. When we come over to even recently, we are covering a very major part of cancer. We have that program, and for the Southeast, we have the Center of Excellence in University of Nigeria Teaching Hospital at Enugu. They dispense some of these cytotoxic drugs that are very, very expensive, although there is cost sharing in those areas. But actually, everything is covered. It's a very, very robust and comprehensive program.
Now that you have not mentioned about cancer, you know, things like chemotherapy, people that have cancer that have to go for chemo, people that are diabetic or people that have kidney and liver problems that have to go for dialysis. These are becoming common illnesses across the world. Are they covered by NHIA, their insurance?
Yes. In fact, diabetes, hypertension are even covered at the primary level of care, because if it is just the maintenance doses of those drugs, they are being dispensed at that level. But immediately there is an organ involvement of their major complications, it's expected that the primary level clinician is expected to refer to a secondary or a tertiary level clinician based on, just like I told you, under the National Health Insurance Authority, the entire health arsenal in Nigeria is at your beck and call. Someone from IMO can even be referred to National Hospital for some of these programs. That's because, I can remember somebody that came to us for magnetic resonance imaging. We found out that in IMO, I don't think there is any healthcare center that offers some of those. So the person was quickly, the HMO was called, and the person was quickly referred to obtain the services in Port Harcourt, and then another one was sent to Enugu to obtain the services and then bring them.
Okay, thank you, Mr. Chile.
So all those dialysis is covered under NHIA, and there are lots of centers that you can obtain the services in for dialysis. Yes.
Some of the problems. So in Imo State, the problem is sometimes there are no facilities where they can get these services like MRI. Maybe there's no place they're having MRI, so which means you have to refer. They can go to another state or something like that. Dr. Olike, Over to you. What and what are covered by Imo State Health Insurance Agency? What and what are covered? And I think you have said that you need to be a little bit more specific too about where people that have Imo State Health Insurance can also go for treatment. So please, can you, or do you want to go the approach of Mr. Chimeze about what is not covered? You know, because his own says many things are covered, only a few are not. So what and what are covered and what are not covered? Dr. Ebolike.
Okay, thank you very much, Father. Imo State Health Insurance Agency is the primary purchaser. So we are a bit careful and also circumspect in terms of consideration of what is in the benefit package. Because as a primary purchaser, it is your responsibility to make sure that you are up on your game and providers are paid as at when due. So our standard benefit package covers most of the morbidity. Let me use the language that people will understand. Most of the illnesses that are within our environment. And it takes care of you to ensure that you're healthy. So it covers things like consultation to see your primary physician, and also covers you seeing your secondary physician in a case that you need a referral. So you don't need to pay for card. All you need to do is to access the facility both as a primary beneficiary or a secondary beneficiary. That's one. Normal medical and surgical interventions. Medical interventions, they say common things occur commonly. Malaria treatment, enteric fever, diarrhea disease, hypertension, diabetes, and all that, including some surgical interventions like laparotomy, appendectomy, herniorrhaphies, prostate surgeries, and those that also require eye care. Like recently, we have done like 8 cases of cataract surgeries at Imo State University Medical Center, which is one of our new centers for cataract surgeries. So that's what we've been doing. We don't cover chemotherapy because we don't want to lie to people. The cost burden for chemotherapy is on the high side, and we wouldn't be able to tell you what we don't do. At the agency, I am not much interested. We are not much interested in the drugs and consumables that are used in the facility.
Dr. Chenna, I think you're having network issues there. Oh, network challenges.
We have
I know we have been having too much network issues back home.
Payment mechanism that. So when you have a session for our mother, yes, can you hear me now? Can you hear me, Father?
Yes, I can hear you now. Yeah, I can hear you now. Oh, you're off. I mean, we can understand that we've been having network issues in Nigeria, so it's none of their faults. We have this, problem with the fiber optics under the Red Sea. So we can understand the challenges they are facing, and I think everybody in Nigeria is facing the same network issues. But we'll see when they come back. We address the last batch of the questions, and then I'll wrap up. I know this one's webinar will not be enough. Mr. Chimeze, Dr. Ebolike is out. I think he will try to log in. But before he comes back again, how do you deal with hospitals and pharmacies or care centers that refuse to accept insurance, even though they have insurance, or they come and tell you, oh, we don't have this drug, we don't have that? Are there mechanisms in place to bring them to book, to make them comply? And because yesterday I got a message from somebody that went to FMC and they said, oh, they don't have the funding to provide the medicine. And I was like, what do you mean by the funding to provide the medicine? when I have already paid for the health insurance? So, and you're getting capitation and getting something, why wouldn't you use the money to buy the medicine? So what's going on here? What mechanism do you have in place to ensure that care providers are compliant? And what can a beneficiary do? Can we, I know in our office, we ask them to call us and we fight for them, but there are some assurances that even when they come to us and we go to you, that we will get people will get what they have paid for.
Exactly. We do conduct lots of
there's a general network glitch here. I don't know if I can round up.
Yes, Dr. Uchenna. Okay, maybe you can round up if you're having network issues.
Okay, so let me round up on the conversation we are having before the network issue. The issue is that the provider payment mechanism we use at the agency, at the State Health Insurance Agency, enables quality of care. They must provide the drugs because every provider has signed a service level agreement that is justiciable. This service level agreement can be taken to court. So in the moment that you have an enrollees, it is your responsibility to provide those drugs. In the event that those drugs are not provided, we can take you to court. So we have what is called the inspectorate units that visit these facilities on weekly basis to ensure that quality of care is optimal. But however, the comparative advantage we have is that we are in the 27 local governments here in Imo State. Can you hear me?
Yes, I can hear you. I can hear you. So, Dr. Chenna, Dr. Chenna, you have talked about how you are making sure that healthcare providers are serving people. Those that have enrolled in your health insurance, if they feel like they're not well treated, or if they go to hospital, they're not getting the care they want, do they have any mechanism? Is there any mechanism in place for them to report and then for you to take action?
At the back of their card, our phone numbers are there. At the facilities, our phone numbers are displayed. But let me tell you the difficult thing here. The Imo State Health Insurance Agency does a clustered enrollment process. So no provider would want to misbehave. There is no provider in Imo State that has less than 1,500 lives. So we didn't give to everybody. We gave to the lives to the people we are sure that will render those services. And that's why till today, after 1 year, we have commenced implementation of BSPF. We have never had one single case. Till today, after we're on the 5th month of implementation of the formal sector program, no complaints. Because you cannot have over 1,500 lives and you misbehave. I don't want to mention names. There are some tertiary facilities here we don't use. We don't use based on that we consider them not because
Okay, Dr. Uchenna, I think you're having too much. But you have made your point. I think you have made your point.
Amount of money and you're not rendering services to me. So our accredited services. In a way, can you hear me now? For instance, we have teaching facilities. All these facilities are all currently rendering services for us.
Okay.
Thank you.
Thank you so much, Dr. Uchenna. I think you're having network issues, and I think we have all gotten you. Those that enroll in your insurance, you have your list of providers, and they can go to those places and access services. I'm hoping that by the time people get enrolled, they are properly educated about what benefits that they can get, and that if they don't get those services, then they can call you. And then when they call you, then you can discipline those facilities. But so far, you have not gotten any complaint yet. Thank you so much, Dr. Uchenna. You can still stand by, but at least we have gotten the substance of what you're saying. And I'm sure that our listeners, some of them have questions, or I've been asking the questions for them, so they may not have any more questions because I've been part of the system. So I know what the concerns of the people are, and I do get the questions all the time. So Mr. Chimeze, so when people do not get services, because we get these complaints all the time, oh, we went to this hospital and they say they don't have medicine, and then they, they say they don't have this, they don't have that. What structures are you putting in place to make sure that the people that the hospitals have chosen are giving us what we want? Do you have a way you discipline those hospitals or make them give the enrollees their due rights, Mr. Chinet?
Okay. There are lots of ways of harvesting complaints and enrollees' concerns. The first one is by the enrollee, he himself taking the proactive step to come into our office to lodge a complaint. The second one is by insisting that the hospitals deploy they have complaint boxes that we can open and then get complaints from inside them and then resolve them. Then another one is that we still conduct some monitoring exercises, including the quality assurance exercises and the monitoring and evaluation. We also even conduct customer satisfaction surveys, with which we elicit some of the complaints. Now, when there is a complaint lodged against a particular healthcare facility, we visit the healthcare facility and then investigate the matter. And if they are found culpable, there are provisions within there are lots of provisions within our operational guidelines to ensure that they are brought to book. It may even lead to de-accreditation of the healthcare facility and then redistribution of the lives that they are expected to manage. So, and I'll not lie to you, since I came to you, there are times that it may even necessitate a refund to the enrollee.
Okay. Thank you so much.
Immediately we establish that the enrollee's rights were infringed on, we call the people that are supposed to be the admin section of the hospital or the medical director or whoever is supposed to be calling the shots within the hospital, and a redress is installed.
Okay, thank you so much, Vera. Thank you so much. I know we can't exhaust everything about health insurance in one webinar. We have our listeners, we have our viewers. If you have any questions that we have not touched, we have not answered, please, this is a good time to raise your hand and I will bring you in to ask the question, or you can chat it in the comment box. I'm sure we're going to have another session and we're going to have another, because this is something that is very important to our people, and we will make sure that our people are getting the best. Health insurance is important. We are calling on all the people that can enroll people in health insurance. Please do. At our organization, CSAAE, we had to go into this because when I found out that this was a treasure hiding in Imo State that nobody was taking advantage of, we decided to go into that. We decided to help spread the word. In fact, our office, we go from church to church. Tomorrow, they're going someplace else. Last Sunday, they were at every Sunday, they're in one church or the other, talking about health insurance, encouraging people to access health, to enroll. It's not very expensive. And one person can even enroll in his entire community. One person can even enroll his entire kindred. Some of us are just building infrastructures, building this, building that. But of what use are infrastructures when people you are enrolling do not have good health? When the people are building infrastructure, they are building the facilities, they are not have good health. At Christmas, some of us will spend 300,000 or 500,000 naira to buy cow and kill for your people. Cow that is going to give you high cholesterol. Without 500,000, you can enroll up to 50 of your people. So, let us enroll our people. At our office, we enroll it. There is a process in enrollment. You have to pay remitter, you have to do quite a few number of things to get enrolled. So we have a desk that takes away that burden from you. So if you come to office, they complete everything. And of course, if you have problems, if you call us, we are always in touch with Mr. Chimeze every second, and he responds to us in a minute. We're always in touch with Dr. Udenna, and he responds to us in a minute. So this is our own contribution as a social development organization in Imo State. Now they may charge you a small fee of maybe 3,000 or 4,000 to be able to do all these services for you, come to your house, take your picture, go to your office, go do that, and do the running around, which is also sometimes a hindrance for most people, because if they come to NHIA sometimes and maybe they have to stay in line, or that it's not working, or they can't get all that. And so in all over the world, we have third-party organizations that also come in and help government to make health insurance accessible to people. So we are encouraging our people. You have had it now from the horse's mouth. We are encouraging our people to please sign up for health insurance so that your people can, I mean, even if it doesn't cover everything, at least for the basic things that it covers. I know when I went to the hospital for malaria, I think they charged me 10,000 or something, but I eventually paid 1,000 naira. They say this is my copay, is my percentage or something. And it was very good. In fact, I felt, that was the first day I felt like a Nigerian. So that was, I would say that was about the first thing I had benefited in Nigeria, apart from the cheap fuel we used to buy before that they removed the subsidy. So I really felt very good about it. I mean, it wasn't like 10,000 was a lot of money for me, but I felt very good that for the first time, I'm benefiting something from this country. Joshua Benson, you had your hand up, or you don't have the question anymore? Joshua Benson, you had your hand up before. You don't have the question anymore. Benson, Joshua, Kingsley. So if you have a question, please show by raise of hand. Joshua Benson, go ahead. Joshua Benson, unmute yourself and speak. Joshua Benson, unmute yourself and speak. Joshua Benson, if you're hearing me, unmute yourself. Maybe you're having network. While we wait for him, Kingsley, unmute yourself and speak if you're hearing me. And please let us be brief about it.
Okay, please, my question is this. My name is Kingsley. Can you hear me?
Yes, we can hear you.
Okay, most times when you approach most of these facilities, they tend to delay. And if you go deeper, it looks like they are not paid capitation on time. So I want to know how quickly do these health insurance authorities, whether it's IMSHA or NIHA, pay the HMOs their capitation, because it also affects their service at the back end. They may not know what we are passing through, but if you go there, they will tell you this is not capitated, this is not capitated, and at the end they discover they are not even paying them on time. So I want to know how quickly they pay capitation to HMOs.
Okay, thank you. Mr. Chimeze, can you answer that?
Okay, okay, thank you. So look at the station of things. The way NHIA affects payment is in such a way that we pay hospitals on quarterly basis, so that they will not claim that there is no money or there are no drugs when you come. And that's exactly why I say that if they tell you that there are no drugs, you are free to come in and lodge a complaint against them. Now, these hospitals are paid on three-month basis. And we pay, so they are paid by the HMOs. We pay the HMOs to pay them. So capitation is one of the basic things. In fact, payment of capitation is incentivized. That's if you pay capitation, that's if the HMO pays capitation, it means that he's managing the patient. But when you don't pay the capitation, it means that you didn't even manage the patient ab initio. And therefore, NHIA is at liberty to recoup the money. So they are forced to pay capitation. So I can't, I don't know the hospital that you went to that started telling you about capitation payment. And it is not even, if they have any issue with any HMO's payment, they are at liberty to lodge their own complaint against the HMO in NHIA. So it is not for them to discontinue the management of the patient. Then further, there is a little correction I wanted to make to something you said earlier, that you were sick, you went to a hospital, they asked you to pay 10,000, but the co-payment was just 1,000. Co-payment under NHIA is only attached to drugs. It's not the whole procedure. Like for investigations, there are no co-payment for investigation. And the reason why NHIA attached co-payment to drugs is because of the fact that drugs can actually be taken and resold. In fact, we have had some moral abuse cases where some people went to hospitals, related other people's symptoms and experiences, collected drugs, and went and sold to them. So that's exactly why there is co-payment attached to drugs alone. But the co-payment is not attached to other procedures or services that we are rendered to you.
Thank you so much. I mean, yes, the truth is that I paid the 1,000 for the drugs, not for the procedure. Okay. Yeah, because my medication was 10,000 or something, so they asked me to pay 10% or 1% of it, that 1,000. Yes. So you're right about that. So you guys have had it.
I need to add something to that. You see, there are many reasons why providers don't render services as at when due and appropriate services. One is that when a provider does that and there is no punitive measure, the provider will continue. The reason is being our provider payment method enables the provider to bear the risk, more especially.
We have lost Dr. Uchenna again. I think serious network problem in his area. But we're rounding up. I think we've been here for over an hour now, and I'm sure that people will be having challenges with their data and everything. And also, of course, they have other things to do. So thank you, Mr. Chimezie, for the huge and wonderful exposition of the NHIA or NHIS, whichever one it is that you have done today. We are really very grateful about this, and we will continue this discussion because this is something that is of importance. You know very well that the awareness is very poor. Okay. Dr. Uchenna, are you back? Okay, so he's having network problems. So you know that the awareness is very poor. We at CSA, we're taking up the awareness. It's costing us a lot of money and energy and time, but this is what we're doing for our people. And we are also inviting people to support us in this awareness in any way that you can. You support us. It costs us money. Tomorrow, our team members will be, I don't know which parish they will be in, to talk to people about these things. You know, awareness is very key. Knowledge is power. If our people don't have the knowledge, they won't be able to take advantage of this health insurance. We are not providers. We don't have our own hospital. So even if we enroll you, we're enrolling you for other people. But we want people to take advantage of these opportunities. They may not be perfect, but at least let's begin from there. And it's when we start using them and start giving them feedback, then they will continue to improve on it, continue to add things and remove things until we get to where things, where we want to be. The health insurance is actually cheap and it's affordable. I'm asking people to enroll yourself and enroll your communities, enroll your families, enroll your age grade, enroll as much people as possible. We spend money on other things that do not matter. All of us, most of this Christmas, most of our big men, most of people abroad spent millions on food and drinks and clothes and football matches and everything. But they could have used that money to enroll everybody. And every day people are calling you on the phone, asking you to send them 100,000, 200,000, 150,000 for medical treatment, for childbirth, for malaria, for this. I don't know how you feel about that when with 15,000 or 20,000 naira that you can enroll that person for a whole year and you're free. This is true empowerment. This is teaching somebody how to fish and not fishing for the person. So I'm really very happy and passionate about it. And I'm hoping that at CSAAE, we set a standard for ourselves that in the next 5 years, we should be able to raise as much awareness that 80% of IMOLITES will be enrolled in health insurance. I hope that you guys can help us in this ambitious task to get Imo State all healthy and all well enrolled in health insurance. I don't know who has his hand up. I don't know who has his hand up. Somebody has his hand up, but we're close.
It is I.
Okay,
a very quick question.
Okay.
What sort of sensitization is going on in the rural areas to make this awareness possible? I came across this webinar by accident today. So I'm pretty sure a lot of people don't know about it.
Yes, thank you, Nze. We are doing our best. See, the truth is that, and Mr. Chimeze is here. I don't want to make him look bad, but government does not have really structure for sensitization. Even when we went to their office, we discussed with them. There is no budget for awareness for the National Health Insurance Scheme.
We do.
Yeah, but
we
have not gotten any to help us who have been sensitizing.
In fact, I'm just coming from where I went to speak to ICANN members. Yeah, I just came in from there, and like I just told them there, some of the rickety vehicles we have do have insurance, but many of us that are riding the vehicles do not have health insurance. Sometimes you go and talk to some people and they'll tell you, God forbid that they're not the ones that will fall sick. But people are still there in the hospital.
Mr. Chimeze, what he's asking is that he thinks that most people do not know about this health insurance.
No,
so he's asking about what incentives or mechanisms do we have in place to make sure that more people get to know about. And I think I agree. I totally agree that the problem with this is awareness.
So truly, we have been in the radio. We have visited lots of denominations, just like you say. In fact, last 2 Sundays I was in Christ Embassy. There is the other one that I had to go. So we have visited lots of hospitals. Lots of churches.
Can I chip in again? I'm sorry to interrupt you, Doctor.
Yeah, go ahead. Yeah.
You see, we have traditional rulers, the Alademas, and so on. This would be a better way to bring awareness at the local grassroots level. Churches are fine, but not everybody go to church. In fact, some of them won't even listen to this kind of thing in the church. As Father said, some of them would reject it in Jesus' name in the church, because they think that whoever is presenting this is wishing them illness. I mean, knowing our people's mentality. So again, I would urge that one of the ways to explore, to bring this to the level of everyone, would be to let the Eze in council tell their people what's going on through the Nzes and so on, the Aladima meetings, as well as the churches. Anyway, that's just a suggestion from me.
Thank you, sir. So you are very right. And let me say that you are very right about it. You see, at our organization, we have taken it upon ourselves to promote this thing. But sometimes, I'm sorry to say this, and sometimes we go to the traditional rulers and they're asking us for something. They're asking us for drink, they're asking us for money, for them to bring the community together. But when you go to the churches, they don't ask you for anything. They allow you to address the community. So
makes sense.
Let us also take the message. Let us also let the Ezes and the PGs know that this is something good for their community. Why would they be asking us? We are not gaining from it. We are just trying to bring awareness, and you are then asking us for more money. When we have people that have come and say, we want to talk to your people. We have gone to some communities, and some of the Ezes were like trying to ask for some things before they could then spread the word. So maybe we should take the word out there to them and say, this is a good thing. And this is something every Eze should, in civilized society, every Eze should ensure that everybody in their community is registered. And if any organization is coming to say these things, then they should in fact, they should even provide transportation and light refreshment to organizations like us that come to them to come and talk to them about these things. But again, our people in Imo State just want you to give them money to even you want them to go to school, you pay school fees for them. They also want you to come and take them from home and bring them to school. So that's the problem.
It's the dependency culture that's been inculcated in our people, and we need to eradicate that as well.
Yeah, thank you, sir. You have made a very good point. Well, I think I've stayed too long here. Thank you, everybody. We are going to continue this conversation. I'm glad that somebody stumbled through this thing, and I'm sure that is the way other people will stumble through it. We want people to be stumbling through it. We are going to continue. We spent money to promote this on Facebook. We spend money, our own money. And I'm passionate about this because it is good for our people. So, I mean, the government people are here. They're working with us. Of course, they know the challenges. People invite them too. When they organize program like today, we're not paying, he's here. I mean, that is their work to promote this thing. So it's our collective mentality. If you a collective work, if we go to civilized nations, NGOs, community groups, churches, they come together and support and sponsor some of these awareness programs so that their people can benefit from it. Government will not do everything. Government must not do everything. The insurance is there. But even in America here, we see NGOs, we see groups coming to talk to us about the program, about this test, about this, that, about this, that. It's not government. So our people should also then begin to take, jump in and say, okay, this thing people are talking is true. Come to our community and talk to my people. How much do you need? Is it transport money? Is it whatever you need? Come and talk to our people about it. What are the SS doing? What are the PGs doing? What are the chiefs doing? What are the Nzes doing? What are the Ozons in the communities doing? What are they doing? What are the priests and the pastors doing in their churches? They should be calling us every time and saying, come talk to us about this so that our people can sign up for this. But no, we are rather going to them. And sometimes they are even doing shakara for you. When you're coming to them to tell them you want to come and talk to their people about it, they're doing shakara. They even want you to pay them. It's ridiculous mentality. And Dr. Nze Ahana is right. It's dependency spirit. This one, I know we have gotten it wrong with some government things. See this health insurance one? They have not gotten it wrong, at least for now. And I'm calling on everybody to please key in. I mean, there are so many things not working well with our government, but this health insurance will, at least they are trying. Even if they're not doing 80%, they are 100%, they're doing up to 70, 80%. And that is why I am at the forefront of it all. I'm at the forefront of we need to be isolate things. Yes, some things government don't do well, but this one is working. People in the Southwest are using this thing. People all over the country are using it. Imo State for their own to convince them to take it insurance.
Please, let me give
It's raining torrentially here in Owerri. I'm very sorry. It's raining torrentially here in Owerri. I'm very sorry for the glitches we're having. This my part of Owerri is raining torrentially. But however, thank you for the wonderful work you're doing. But in terms of things that the basic healthcare INEC word now in Imo State that will say they have not.
Father, let me jump in here and just give a shout out.
Mr. Nzani, go ahead.
Let me please give a great shout out
on meeting, not just meeting.
Network issue. We're having a problem. Dr. Uchenna, is okay. We have had. I know you are having network issue. Please, Dr. Nze Ahana, please, can you go ahead?
Okay, no problem.
Yes,
go ahead.
I was simply giving a shout out to Professor Kenneth Anation. He was the one who made me aware of this. I wasn't sure what I've been meeting. I am greatly impressed because this is what the kind of dispensation that is needed at this level. It's in fact, to me, that's top priority. So I am extremely pleased to be in your midst this night. Thank you all very much for the efforts you're making. I'll do my 2 penny worth if I know what to say to people and how to highlight this, flag this to them. I wouldn't mind joining the crusade to make the awareness available in the community. Now that I know, I'd like to talk to somebody who can point me in the right direction on a way to showcase this and also to be a participant. Thank you all very much.
Thank you, Nzea. And you can leave. You can leave your number for me in the Zoom, and I will follow up on you. And we thank God that you have come to this awareness. We are here. Come to us. Anybody, if you want us to come and talk to your community, reach out to us. If you want us to come and talk with your group, we are working with Mr. Chimezie. We are working with Dr. Ewolike. We are all into this together. So anybody here, you need us to talk to your diaspora community, you need us to talk to your age grade, you need us to talk to a certain network, your old boys association, reach out to us. Reach out to CSAAE. We will arrange for it. We will bring Chimente, we will bring Dr. Ewolike, or our team members will come and we can educate people. We are very willing, we are very ready, and we thank those that have been inviting us. Some churches and groups have also been inviting us and be doing this now. One of my friends in Ebony told me that the Catholic Church there is going from community to community, talking to people about health insurance. Imo State cannot carry last. We cannot be behind. We cannot be left behind. We must take advantage of what is there in place for us to help people. So thank you, Dr. Nzea. Please leave me a message in my WhatsApp, leave me your number there, and then we'll be able to continue that conversation from here. I think we have stayed too long today. We need to allow people to go and rest. Thank you, Mr. Chimezie. I assure you there will be another session, and there will be another, and there will be another. This is the kind of conversation we should be having.
Father, before we conclude, we just celebrated 1,200 babies in 1 year where we have delivered through the health insurance agency.
Congratulations.
So it's something that Imo State people also need to celebrate. That's the highest in the country.
Congratulations, Dr. Uchenna. You are doing a fantastic job. I'm seeing your work. You have taken this very personal, and I'm very, very proud of the work we are doing. The best way to achieve this goal is for all of us to partner together, to work together, to come. And this is what partnership looks like. We're coming from the development sector, the government people coming together, and we are all doing this. There is always going to be a common ground. Whether it is APC or PDP or anybody, all of us need healthcare. When it comes to healthcare, there is no politics. There is no Uzodema. There is no Tinubu. There is no anybody. It is the same because all of us will get sick. So this is one of those things that transcends partisan politics. And I think I want us to continue in this direction. There should be no politics in this thing. If a governor is doing well in this area, we must give him credit for it. We don't care if Uzodinma is doing it, we must praise him. We cannot say because he's not a member of my party, then we cannot thank him for the work he's doing. If Tinubu is doing well in the area of health insurance, we must praise him. I mean, we can criticize them in other areas, but health insurance, health is wealth, is life. If you don't have health, you have nothing. And we must revolutionize it. Together, in the next 5 years, 80% of IMOLITES should have health insurance. That is our mandate. That is our goal. And we hope all of us can rally around and get all our people into health insurance. Thank you so much, and God bless you all.
Father,
And you too.
can we at least have some closing remarks?
Sure, go ahead. Go ahead and say your final words.
I will really want to enjoin people, including the Chief Nze Ahana. They can have direct access to our office if that's exactly will serve to broadcast the message further. And we have reached out to lots of fathers, so many of them still do propagate the gospel, that's the health insurance gospel, of course, to their people in their churches. In fact, there was the other day that we registered like 15 fathers on one day. They just came in, subscribed, and all of them are really enjoying care at this particular point in time. So can I quickly drop the fact that our office is along the Shell Camp Road, that's opposite the Market Square that is around that Amakohia area. So the Chief Nzahana will really be glad to have you talk about some of these things, and then the programs that we have that you can subscribe with. And
okay, thank you so much, Mr. Chimezie. You have really done very noble. Their office is in on Makoya Road,
number 2,
and,
yes, number 2
yes.
Shell Camp Road.
Yes, so if you want to go there to see them, please do go there to see them. Thank you so much, everybody. We have stayed too long. I think we need to wrap up now. Thank you, everybody. Thank you, Dr. Uche Welike. Thank you, Mr. Chimezie.
I need to do my own closing remark now, Father.
Okay, please do. Okay, please. But it's just you're having too much network problem.
First and foremost, yeah, it's raining here. Seriously, it's raining. It has been raining the last 1 hour, but we're managing it. I've been changing different networks to be able to communicate. First and foremost, I want to use this opportunity to thank you, Father Bagwa, for your commitment in ensuring that people have the information. Information is key, but when it comes to health insurance today in Imo State, it has become the front burner. Both is positive political externality and in terms of program implementation. IMO is on the front burner for health insurance. It's not something to argue, but we want more people to show interest in enlightening people, just like you are doing. You don't need to come to my office. If they can go to CSAAE, we have good partnership with them. They will come to us. The most important thing is that we have the capacity, we have the technical know-how, we have the institution, we have the framework, we have the integrity to implement the program, and we are currently implementing it. And finally, we have the political support of His Excellency Distinguished Senator Hope Uzodimma, the governor of Imo State, who has given us all the support to implement this program. When you see our videos, you see that these people that are currently benefiting from the Vulnerable Populations Fund, they are not politicians. They are rural people. They are people who live in the hinterlands, people who live in the villages. So such political will to be able to freely implement this program is also commendable. And that's why Imo State has the highest utilization in the country. So it's something that we need to celebrate. For the Imo people, we hope to do more. Thank you.
Thank you so much, Mr. Dr. Ewelike. Thank you so much, Mr. Chimezie. You guys are so passionate about your work. I wish all the civil servants in Nigeria would be so passionate as you people. You guys are really, really so passionate. And I read on Dr. Ewelike's Facebook today that his salary finished on the 16th of this month already. And maybe I hope that was a joke, but it's not like he's earning ₦1 million. But yes, he's so passionate about this work. And Mr. Chimezie, so passionate about the work. This is what we want civil servants to be doing, government officials to be doing, not just not doing anything. They are giving us figures, statistics of what they have done. My people, we need to be discretionary. If we see those who are doing well, we need to praise them. Dr. Nzahana has also mentioned that Professor Amechi, shared this flyer with him. We thank him for also promoting this program. Now, Professor Nzahana has shown interest simply because the Chief Economic Advisor to Imo State Governor shared this flyer with him. Any little way you can contribute towards getting this message out, towards helping one person to get insured, please do well to do that. Thank you so much, and God bless you all. Enjoy the rest of your evening. Sorry, it has been a long time, a longer conversation, but nothing is more important than health, and we can spend the whole day talking about it, and hopefully we have achieved something very positive today. Thank you, Dr. Ewelike. Thank you, Mr. Chimezie. Thank you all those that have asked questions and contributed. God bless you all. Our office at CSAAE is on Fire Service, Mbise Road, 77 Mbise Road. You can't miss it. Just that roundabout there. Once you look up there, you'll see us on the 3rd floor on that building that has mocha foam at the bottom, just on the fire service. If you come there, you can't miss it. Very imposing. Our phone numbers are there. Our website is there. Our email is there. We also have a toll-free line, 0800 900 1000. When you call our toll-free line, you don't pay nothing. You don't lose 1 minute. You don't lose data. You don't lose nothing. MTN does not charge you anything because we have already paid for you ahead of time. So you can call us if you need health insurance or if you want to complain about not being able to access service or anything. You can write us email on info@csaae.org. You can also call our official lines. They are everywhere. If you go to our website on social media, Facebook, LinkedIn, Instagram, we are all over the place. Once we get your message, we'll act on it. If you reach us, you have reached Chimezie. If you reach us, you have reached Dr. Ewelike. We are in touch with them on a daily basis, and we are always communicating. We are all into this together. Support us so that all of us will get wealth insurance, and it's good for those of us who are doing well. Are you happy that people are calling you every day, asking you for money for childbirth, asking you for this? Why not just give the person health insurance for 1 year and say goodbye to distress medical health call? Thank you and goodbye, everybody.
Thank you.
Thank you.
Thank you, Father. Bye, everyone.
Yeah.
This is a wonderful forum. Thank you very much.
Because no go for the when he with the number now, so that I can maintain contact. This is the kind of thing I've been hungering for many years. The fact that it's happening and I came by it by accident, I really thank God that, and like Father said, I know how much it costs when an emergency comes through on the telephone. And to have this kind of cover is a lifesaver, honestly.
Okay, thank you, everybody. And we have come to the end of the program. Yeah, Doctor.
Thank you. Thank you.
Yeah, thank you very much. You may exit now if.
Okay, bye
yeah.
for now.
Thank you for now.